The ankle joint. By the end of this session, the student will be able to recognize the different anatomical landmarks around the ankle, elicit the normal range of motion of the ankle joint, palpate the joint and the tendons while observing the patients, perform special tests for the ligaments of the ankle. Good morning. I am Dr. Reem Mallah, Assistant Professor of Physical Medicine, Rheumatology and Rehabilitation at Chams University. Today, I'm going to show you how to examine the ankle and foot joints. The ankle joint is a synovial hinge joint connecting the lower end of the tibia with the proximal end of the talus, while the foot composites of a lot of joints, the subtalar joints, the metatarso-pharyngeal joint, and the interpharyngeal joints, for example. صباح الخير.
صباح الخير.
أنا دكتورة ريم الملاح. أنت اسمك إيه؟
سيد سالم.
عندك كم سنة يا سيد؟
49.
بتشتكي من أي ألم في الكاحل أو في رجلك من تحت؟
لا.
طب تسمح لي أفحصك؟
اتفضلي يا فندم.
شكرا. Ensure both ankles and feet are appropriately exposed, and from the knee down, the legs is also exposed. Ask the patient to stand straight forward like this with the 2 feet looking forward. من فضلك يا سيد اقف عدل زي العسكري وباصص لقدام. Now we will start the inspection from the front. We will see the symmetry of the feet and the ankles, the toe alignment, hallux valgus of the big toe, bunions located at the first metatarso-pharyngeal joint, deformities of the toe, scars suggestive of previous injury or surgery. Callus may indicate foot or gait deformity or poorly fitting footwear. Swelling or edema of the foot or ankle suggests injury, inflammatory arthritis, septic arthritis, or cellulitis. Also, we have to examine the foot arches, checking for pes cavus or pes planus. Now we will do the inspection from the side. من فضلك يا سيد لف. The foot arches, we are going to observe the evidence of flat feet or high arched feet. If the patient has flat feet, ask to stand up, tiptoes. من فضلك ارفع رجل واحدة يا سيد. To see the arches of the foot. نزلها تاني. ارفع الناحية التانية. شكرا. لف يا سيد. Now we are going to inspect from the back to see the foot and ankle symmetry, the heel alignment for valgus or varus deformity, the Achilles tendon deformity or discontinuity, swelling that may suggest Achilles tendonitis or erythema. من فضلك امشي قصادي يا سيد. Observe the gait. See the normal gait cycle, the normal heel strike and toe off. See the smoothness and the symmetry of the gait. If you have any antalgic gait. من فضلك يا سيد امشي على طراطيف صوابعك. Ask the patient to walk on their tiptoe. Difficulty may suggest a problem in the calf muscles, Achilles tendonitis, or pain secondary to joint problem. Inspect the patient's shoes and look if there is uneven wear in both insoles or if we have any insoles inside the shoes. Now we are going to complete our general inspection while the patient is lying down. Ask the patient to lie down in bed. See for the nail changes, skin changes, toe alignments, any scars or erythema presence or joint swelling, if we have any lower limb edema. Now we are going to start the palpation. The palpation is to know how the joints feel. We are going to use the dorsum of our hands to compare between the different areas and with the other side. Here's the ankle joint and above it, ankle and foot. Comparison with the other side is very important. After assessing the temperature, which may indicate presence of any inflammation or arthritis, we are going to assess the pulse. We are going to feel the dorsalis pedis pulse in the first swab space against the second and third cuneiform bone and the posterior tibial behind the medial malleolus. And we are going to feel it on the other side too. Now we are going to palpate the joint and the bone to see if we have any tenderness or swelling or irregularity. We must be looking at the patient facial expression while we are assessing the tenderness. We will start from distal to proximal. We will do the metatarsal squeezing tests, and then we will see if we have any tenderness over the metatarsals, the tarsals, the ankle joint, the medial malleoli, the lateral malleoli, the lower end of the tibia, the lower end of the fibula, and the calcaneus. Definitely we are going to do it for the other side. We'll do the metatarsal squeezing, the metatarsal tenderness, the tarsal bone tenderness, ankle joint tenderness, the medial malleoli, the lateral malleoli, the lower end of the fibula, the lower end of the tibia, the calcaneus. We will start by the active movements, meaning that the patient is going to do it by himself. فضلك يا سيد خد مشط رجلك عليك. This is the dorsiflexion. نزل رجلك لتحت. تمام؟ يفضل تعملهم مع بعض يا سيد. It's better to do it in both sides together so you can be able to compare between the two sides. هات مشط رجلك عليك. نزلها لتحت. صوابعك هاتها عليك. صوابع بس لو ينفع. أيوة. Okay. We will do the foot inversion. هات رجلك لجوه يا سيد. And the foot eversion لبره. Now we are going to examine the passive range of motion of the different joints of the ankle and the foot. We will start by the ankle, plantar flexion and dorsiflexion, the subtalar joint for inversion and eversion, the mid-tarsal for inversion and eversion, the big toe flexion, the big toe extension, the other fingers extension and flexion. Now we will start the special test for the different ligaments of the ankle joint. We have a lot of ligaments in the ankle joint. What's the most common is the lateral ligaments. They are the most liable to injury, especially the anterior inferior talofibular ligament, and then the calcaneofibular ligament, then the posterior talofibular ligament. We will do the special test for these three lateral ligaments. I have to support the joint by my left hand over the heel. Hold my right hand like this. Ankle in plantar flexion, and I will do inversion. If I have laxity in the anterior inferior talofibular ligament, there will be more inversion while I'm doing the stress test. I will repeat the test again, but in the neutral positioning and stressing by inversion. This is for assessment of the calcaneofibular ligament. Again, in dorsiflexion, and I'll do inversion. This to assess the posterior talofibular ligament. Definitely, I looked before this for any local swelling here or erythema to be sure that I don't have any other ligamentous injuries. Now we are going to do the medial stress test. The main medial ligament is the deltoid ligament. Again, I have to fix the heel like this, but now I am going to do eversion to stress the deltoid ligament. And definitely we have to compare with the other side. Another test is the anterior drawer test. It assesses the anterior inferior talofibular ligament, mainly in the acute injuries. The patient will be lying supine, knee flexed 20 degrees, and the ankle and the foot outside the bed. I will hold the heel by my left hand, the feet lying flat over my forearm, and I will stabilize by my right hand the lower end of the tibia and the fibula at the ankle joint, and I will do anterior displacement of the foot. Again, I will compare it with the other side. Now we will do the palpation of the posterior aspect of the ankle and the foot. We will start proximal from the gastrocnemius to see if there is any tenderness. Feel the tendo-Achilles tendon till it's insertion down into the calcaneus. Feel if there is any gap inside the tendon denoting any tear. The last special test is the Simon test to detect any Achilles tendon rupture. To perform the test, we will squeeze the gastrocnemius and see movement in the foot. This is the normal, but if there is no movement, that denotes rupture of the tendo-Achilles. Definitely, we are going to compare it with the other side. Definitely, neurological examination is part of the ankle and foot examination. We have to examine for the power, for the sensation, and the reflexes of these patients. Now we finish the ankle and foot examination. Thank you. شكرا يا سعيد.